This is Dr. J. We're back for more I Teach Statistics and Stuff awesomeness. Today's video is going to be a relatively short one on variables. And you might be like, yeah, I know variables, independent, dependent, but there's so much more. And we cannot go on to more complex statistical stuff until we master the foundation. So this is important. All right, so here we go. We're going to spend some time defining some terms. Let's first talk about a variable. A variable is something that is measurable, and that's important. Something that is measurable, and it can be assigned a value. Different values among a sample of individuals or among a sample versus a constant. A constant is something that is going to be the same for every subject. So let's, as we always do, let's give an example to really outline this. Let's say that my research question relates to how does body fat percentage affect marathon running performance? As a researcher, I may believe that the amount of body fat a runner has may influence their marathon running time and performance. So if I want to look more at this question, then I may want to define the variable and the constant. Let's change colors. Okay, let's go with green. Oh yeah. So what would the constant be? The constant in this example would be marathon runners. Because if I'm going to be doing a study looking at marathon runners, the constant is that they're all marathon runners. So in quote unquote, that measurement, it may not be a measurement. It may be more of a category that's always the same, which does not change. Versus the variable. The variable is something that is measurable and it will be assigned different values. So the variable in this instance, you guessed it, would be body fat percentage because it's going to be different across the sample of people. We're going to be spending most of our time talking about variables because once we set up an experiment, the constant stays the constant, but it's the variable that we're going to be looking at. That's kind of the variable, that's what is of interest to us as a researcher. A couple of things to point out. Sometimes a variable can actually become a constant. If I'm studying only women, for example, then women become a constant. So it can be assigned as a variable, but it might also become a constant. And then when we actually do our statistical tests, that was the wrong symbol for the women. Apparently my mind is not with me today. So it could be men or women. One last thing to point out is when we actually start to do statistical tests and writing up our results and such, we're only going to be reporting on the variables. Because again, that is what is of interest to the researcher. We do want to make sure we set up a constant, but we're going to be reporting on the variables, something that is measurable and that will have different values, not the same for everyone. But wait, you may be asking yourself, well, sometimes I may be interested in studying something that is a little bit more abstract. So here we have another definition, and it is a definition of a construct. A construct is not something that can be directly measured. Instead, it is an abstract entity. And this, of course, in both qualitative and quantitative research, sometimes we're interested in something that cannot be directly measured. And that's okay. We just have to identify that and do a couple things to make sure that we're doing what we need to do. So first of all, abstract, something that cannot be directly measured. An example of that would be self-esteem. What if I wanted to look at how marathon runners assign themselves self-esteem, and we could even throw in something else in there, their self-esteem based off of either marathon running performance or their self-esteem based off of how they look and their body fat percentage. We can get around this. So just because it's something abstract doesn't mean that we can't use it in scientific research. So if we want to try and assess something that's more abstract, like self-esteem, we're just going to have to measure it indirectly. And of course, anytime we measure something indirectly, we're going to decrease the accuracy. That doesn't mean we shouldn't do it. It just means that we need to recognize that the accuracy may be a little lower. We may indirectly measure something through a subjective scale. So a Likert scale is a good old-fashioned 0 to 5, 0 meaning very low, 5 meaning very high, for example. So we could ask people questions. How would you rate your self-esteem? And 0 meaning very low, 5 meaning very high, and they could assign a number in between. Or you can use an already developed quantified scale. So there's all sorts of scales out there for abstract entities. The such and such scale of self-esteem. And those will increase the accuracy and validity a little bit. But still, anytime that we're measuring something indirectly, it lowers the accuracy. But also, anytime we're measuring something that's abstract, it also lowers the accuracy and validity. Because among a sample of people, we may inherently assign different values to self-esteem. So one person's definition of a 5, good self-esteem, is different from another person's rating of a 5 for good self-esteem. Okay, so moving on, we're going to focus more on variables. So even though I talked about abstract entities that cannot be directly measured, no matter if it's abstract or something that is directly measurable, something that is directly measurable could be like heart rate, very objective. Either way, whether it's measured directly or indirectly and can be assigned different values, there are some important things for variables. Here we start getting into some of the more statistical terms. It gets me excited, but maybe not you. But that's okay, because I'm going to get you through it. When we go to set up a scientific study, we assign variables, and we have to make sure that they are operationally defined, that they are mutually exclusive, and that they are exhaustive. The first one is pretty straightforward. When you set up a study, in your methods section, you're going to operationally define what that means. And all that means is, let's say we're talking about body fat percentage. I need to operationally define body fat percentage. What technique am I using to measure body fat percentage? How is that body fat percentage measurement being performed? What is the scale that I'm using for that body fat percentage? So you must define it. You must define how you're measuring it, specifically. If there's different ways to measure it, like is the case with body fat, you must talk about how you're measuring it. So as an example, I could operationally define body fat percentage by saying, body fat percentage will be measured using the BOD pod. The BOD pod is a measurement of air displacement plethysmography. Subjects will enter the BOD pod and 3 trials will be performed. I'll be using the blank blank unit of the BOD pod. So you're very specific. Okay, the other 2 can be a little bit more difficult. Before I go on though, why is it important to operationally define something? Well, of course, because we want these studies to be reproducible. To increase the validity and the accuracy, you want someone else, another researcher, to be able to do the same thing and get the same results. And the only way that we can reproduce it is if we are specific. All right, let's talk about the other two. Mutually exclusive. This means that everyone must fit into one category. So let's say that I'm doing body fat percentages. How might I define the ranges for that? Let's say that I do a scale such as this. I say, well, our subjects may fall under, let's say they can be less than 10% body fat. They could be 10 to 15% body fat. They could be 15 to 20. They could be 20% plus. Okay. Is this list mutually exclusive? Jeopardy music is playing. And the answer is no. This one is not mutually exclusive. And the reason is because what if someone, the bod pod tells us that they are 15% body fat. According to this scale, if someone is 15% body fat, they can fit into this category or this category. So the definition of mutually exclusive means that each individual subject can only fit into one and only one category or group. So how could we change this to make it mutually exclusive? You got it. We would just have to make some minor changes. We could say less than 10. We could say 10.1 to 14%. We could say 15% to 19%. We could say 20% plus. This is mutually exclusive. Excellent. I know this is a small point, but it's important. All right, and then the last thing is each variable that we measure must be exhaustive. And when we say exhaustive, that means that there must be a category for everyone. There must be a category for everyone. Is this one exhaustive? Is there a category for everyone? Yes. Is this one exhaustive? Is there a category for everyone? Yes. And the reason why is because, what if someone shows up at 8% body fat? Well, we have a less than 10% category. What if someone shows up as 30% body fat? We have a 20% plus. So, in fact, both are exhaustive. There is a category for everyone, but only the one on the right is mutually exclusive. So we would want to use this one. I know these things make sense as we talk about it, but it's really important when you're sitting down to come up with a research idea and then the research methodology. These are all things you got to think about. All right. Let's get into more definitions. I know that you know about these. Let's just make sure that we dot our I's and cross our T's. Make sure you review independent versus dependent. Sometimes they may come up with a different name when we use regression analyses. There's a prediction and a criterion variable. But in essence, it's the same principle. So we can just start our discussion by independent and dependent variable. Independent is, of course, independent variable is what the researcher is manipulating or attempting to look at differences across. Sorry for the pause there. So if we look at my example about marathon runners, here's our marathon runner. There she goes. She's fast. And then body fat. Everyone loves the good old-fashioned skin fold. What would be the independent variable? The independent variable would be marathon runners. So we're looking to see differences across marathon runners. And of course, during the course of a study, the independent variable doesn't change. We know that. What are some other examples? This may not be the best example of an independent variable. Let's say, let's use green. I feel like these are Christmas colors. What if I'm looking at gender? We could have gender as an independent variable, and we could even have different levels of gender as independent variable. We could have men. We could have women. We could have people that identify as all sorts of genders. We could have non-binary. So it's possible to have an independent variable with different levels. Or what if I was looking at marathon runners and I wanted to add different levels? I could say the independent variable is marathon runners, and my levels of the independent variable are recreational, semi-competitive, and professional. So it's still something that doesn't change during the course of the study, but I might be interested in looking at differences across genders or differences across levels of runner. Sometimes the independent variable, you might be manipulating it. So maybe I have an independent variable where it's training level. Let's say that I'm looking at marathon running performance and I want to look at the influence of different types of training. So my independent variable is type of training, and I have different levels. Maybe I have a interval training program, and then I have a base training program. So the training program that I put these marathon runners on is the independent variable. But I have different levels of that, and I can manipulate that. So of my 50 marathon runners, 25 of them I'm putting on the interval training plan for a month, and 25 of them I'm putting on the base training plan for a month. So I can manipulate it, but the fact remains that it doesn't change. Versus the dependent variable, and the dependent variable, of course, is what does change. And we're looking to see if this dependent variable changes in response to the independent variable. So in my example, it would be body fat percentage. So this does potentially change. And so what we're interested in seeing, does it change based on our independent variable that is set? Let's go back to independent variable. If you've watched my other video on hypothesis testing, you've already been introduced to this. And then types of research design. Oh, excuse me. Sorry about that. Types of research design. Then you saw me talk about active versus attributable independent variable. And this is getting a little bit more in the weeds, but since we're here, let's define them. Let's change colors, make things more interesting. We are in a Christmas theme, even though it's not Christmas time when I'm recording this, but it might be Christmas time when you watch it. An active independent variable is one that can be fully manipulated. Or another way to look at that is it can be fully manipulated or randomized, because we can truly randomize something if it can be manipulated. Versus an attributable independent variable that cannot be fully manipulated or randomized. Let's give some examples. Active independent variables. Let's see here. Okay. Something that can be fully manipulated is something that you might need to use if you're doing true experimental studies. What is something that I can fully manipulate? I could fully manipulate training program. So I could put some people on the interval training program, and I could put some people on the foundation or base training program, versus an attributable variable. So there are actually quite a few things that can be fully manipulated or randomized, and therefore can be active independent variables that we can use in true experimental studies. But then there are some things that cannot be fully manipulated. Things like height. How are you going to randomize height? Someone is their height and you can't change it. If you're doing a physiological study, genetic history, you can't change that. You can change control versus experimental. Let's say I want to see the efficacy of a medication that is being developed. You could fully manipulate or randomize who gets the placebo and who gets the actual medication, but you cannot fully randomize genetic history and height. This is important to note because when you talk about the research design, if you're doing a true experimental, all your variables, or as many of them as possible, must be active, versus a quasi-experimental design includes some attributable variables as well. Okay, we are coming down the home stretch here. So when we talk about variables, something that is measured, there's a thing known as levels of measurement. And there are 4 levels of measurement that we are going to discuss. But look at the fireworks. Why should you care? Well, ladies and gentlemen, there are rules when we do statistical tests. Damn the rules. But this is important. So when we later start talking about t-tests, ANOVAs, regression analyses, oh dear, and many, many more. When we run these statistical tests, there are rules. And some of these rules relate to the levels of measurement of our variables. In order to run a t-test, an ANOVA, and a regression analysis, we have to have a certain type or certain level of measurement of a variable. And if we don't, we're going to have to make some adaptations. So it's not that we can't use certain variables that have a certain level of measurement. It's just that if we have a certain level of measurement, we may need to use some alterations. And why do we have these rules? Because if we don't, it's mayhem. If we don't have these rules, then running these tests becomes pretty arbitrary, and it means that these tests aren't telling us what we think they're telling us. It is in fact because of these rules that when we run a t-test or an ANOVA, we're able to confidently say, within a certain range of error, that there is a significant difference between X and Y. And we can only confidently say that if we follow these rules. You may have heard the age-old statistical trope. If you haven't, drum roll please, I'm about to introduce it to you. Listen, when we run statistics, you have to use them wisely. It's not just a magical button that you press in SPSS and wow, look what it tells us. Garbage in to a statistical analysis will always yield garbage out. So we have to follow these rules. Because if we don't follow the rules, in essence, we're putting garbage in. We're being lazy. And it means that these statistical tests aren't telling us what we actually think they are. And it can be irresponsible as well. All right, here we go. Last topic for this variable video. We have 4 levels of measurement for variables. We're talking about variables. And the way that I always remember it is Pinot Noir. Laugh all you want. I'm more of a white wine drinker, but I still appreciate wine. And I always remember in order, nominal N, ordinal O, interval I, ratio R. So let's talk about them. Here's how it works. Nominal is a level of measurement that is the most basic. So it's important that we know these in order. Nominal is the most basic. A nominal level of measurement is a variable that is classified as a group or a category, and it has no ranking. Let's give some examples. Gender. It is a category. Either you are male, female, maybe you classify as non-binary, or somewhere in between. But in any case, it is a category and there's no ranking. Another example of a nominal variable, a nominal level of measurement variable, would be control versus experimental. If I'm looking to see the efficacy of a pill, I have a placebo for the control group and I have the actual pill for the experimental. It is a category or a group and there's no ranking. The next up level of measurement that adds a little bit more specificity is an ordinal variable, an ordinal level of measurement. This is where there is ranking, but not on a standardized scale. Let's give an example. Age groups. Age groups, it is a group or a category. I have 10 to 20-year-olds. I have 21 to 30-year-olds. I have 31 to 40-year-olds, and so on. There is ranking because someone who is 10 years old is younger than someone who is 21 years old. And then someone who's 21 years old is still younger than someone who is 31 years old. But this would not be a standardized scale. Because if I'm doing age groups, let's say that I get a sample of people that fall between 10 and 20 years old. I might have someone, let's say I have 5 subjects. Someone is 10, someone is 12, someone is 17, someone is 19, and someone is 20. So I have 5 subjects that are classified into my 10 to 20 age group. But there's no standardized scale because the differences between each of these is not the same. I think as we go through more examples, you will understand this more. Another example of an ordinal level of measurement would be Likert scale responses. A Likert scale typically goes from 0 to 5. So there is some ranking because a score of 0 means something different from a score of 5, and it's usually ranked. 0, very poor self-esteem. 1, somewhat poor self-esteem. 2, kinda poor self-esteem. 3, moderate self-esteem, and so forth. So there is ranking, but there's no standardized scale because in a Likert scale, it is something that is often subjective. Everyone's definition of self-esteem is different. So if I were to draw out the different response options, the differences between the two are not standardized because someone's definition of a 3 self-esteem is different from someone else's definition of what a 3 self-esteem is. This can be a little tricky, but stick with it. And at the end of this video, I'm going to give you some examples to practice. I want to point out another term, and it doesn't fall into our 4 levels of measurement, the NOIR, nominal, ordinal, interval, ratio. You might see the term categorical. People might use a categorical variable, and that describes variables that can be classified into groups or categories. People usually are thinking of nominal. So typically, if you hear someone say, oh, it's a categorical variable, well, just look at the word itself, categorical. People fall into categories. They're usually referring to nominal. But it could also be categorical. It could also be ordinal. So sometimes an ordinal variable can be categorical. Let's say that I was doing age groups. Isn't that categories and groups? Yeah. But a very important point here. All nominal variables are categorical. But not all categorical variables are nominal. Bad handwriting today, but not all ordinal, sometimes they are categorical. I prefer to actually use nominal versus ordinal because it's more specific, but if you see categorical, they're usually referring to nominal, sometimes ordinal, but not always. All right, let's talk about our last two levels of measurement, interval and ratio. So we had nominal. Nominal was when there's a group or category with no ranking. Control versus experimental, gender. Then we have ordinal, which is when we have ranking, but there's no standardized scale. So an age group between 10 and 20. That's obviously ranked because you could have 10 to 20, 20 to 30, 30 to 40 years old, but there's no standardized scale. My sample of people are not going to have exactly the same differences between the years. So then we move on to interval. And as you can expect, we keep becoming more and more specific. So in an interval level of measurement, the variable has ranking, but it is with a standardized scale. We tend to see a lot of interval variables, but most we're going to see ratio, but we can see some interval ratios or some interval variables. Let's talk about temperature. If I'm doing a study and my dependent variable is temperature, that is an interval level of measurement because there's ranking. So let's say we have 0 degrees Celsius, 10 degrees Celsius, 20 degrees Celsius, 30 degrees Celsius, and 40 degrees and so forth. Although that would be really, really hot. So let's end with 40. There's ranking because 0 is lower than 10, which is lower than 20. And there is a standardized scale. Because when I take that temperature, the differences between 1 degree and 2 degrees and 3 degrees is the same. So the differences between each one are the same. It is standardized. However, in an interval level of measurement, there is no absolute 0. And what this means is, if I get a temperature of 0, you could literally take the temperature outside, and it could be 0 degrees Celsius. But does that mean the absence of temperature? No. So that means that there's no absolute 0. Which means that if you get a value of 0, doesn't mean absence of variable. Temperature is probably the best example of this. If I get a temperature recording of 0, it doesn't mean that there's no temperature. It just means it's really cold. Another example of an interval level of measurement would be average of Likert scores. And this is a little tricky because we used the Likert scores themselves we used, and we talked about the Likert scale as being ordinal, because there's ranking, but there's no standardized scale between them, because people subjectively define things differently. But it's common that if you have different groups that you're measuring, you might actually take the average of Likert scores. And in this case, among an average, there would be a standardized scale. The differences between an average of 2 and an average of 3 are standardized, right? And there's also no absolute 0. You might get an average of 0. You could hypothetically assess self-esteem, feelings of self-esteem with a Likert scale, and you could get an average of 0 for one group. But does that mean that there's an absence of self-esteem, an absence of an abstract entity? No, it just means that it's very low. Okay, by far, maybe the most common, particularly in physiological data, ratio is a very common level of measurement. In a ratio level of measurement, it is the most specific we can get. There's ranking with the standardized scale, and now it has an absolute 0. Time. If I'm looking at sprint distance or marathon running times, there's ranking, because I could have a fast time or a slow time, and there's differences between them. There's a standardized scale. The difference between 1 minute and 2 minutes is the same as the difference between 2 minutes and 3 minutes. And there is an absolute 0. An absolute 0 means a value of 0 does mean absence of a variable. Someone gets a time of 0, there really is no time. They didn't finish it. They didn't even complete anything at all. Other examples, distance. If we're talking about physiological data, heart rate. Heart rate is ranking. There is a standardized scale, because the difference between 60 beats per minute and 61 beats per minute is the same as the distance between 61 beats per minute and 62 beats per minute. And there is an absolute 0. Someone could theoretically have a heart rate of 0, and that means an absence of a heart rate. They'd be dead, but hypothetically, a 0 heart rate means the absence of a heart rate. All right, now these can be tricky. This is why, in the famed words of Allen Iverson, we talking about practice? Yes. It's important to practice these, because you're going to get into situations where there can appear to be some gray area between these levels of measurement. And as I said before, if you don't properly assign a level of measurement, then we don't know exactly whether we're able to plug it into certain statistical tests. And we don't know if we need to do certain alterations. And then, let me hear you, garbage in equals garbage out. Bad news. I'm going to give you a quiz. So, what do you think? Places in a race. Someone finishes first, someone finishes second, someone finishes third. What level of measurement? Nominal, ordinal, interval, ratio. I'm going to encourage you to pause the video and think about it. This is where inductive learning is really helpful. I know it's a teacher term, blah, 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 but really thinking about it helps you with these concepts. Whenever you're ready, join me. Places in a race are ordinal because there is a ranking, but there's no standardized scale. Someone may finish in first with a marathon time of 2 hours and 10 minutes. That'd be really fast. I'm dreaming if I could do that. Second place, someone finishes right behind on their heels, 2:12. But then third place doesn't finish until 2 hours and 30 minutes. So there is ranking, but there's not a standardized scale. The difference between each finisher is not the same. So that would be ordinal. If the differences between each finisher was the same, it of course would be interval. All right, another question. Blood pressure. Again, pause the video, really think about it. Nominal, ordinal, interval, or ratio. You thought about it? Welcome back. This is ratio because there is a ranking, it is a standardized scale, and it does have an absolute zero. This is similar to the example I gave with heart rate. You could technically get a blood pressure reading of 0. They'd be dead. But a blood pressure value of 0 means an absence of blood pressure. All right. What sport a subject plays? Nominal, ordinal, interval, or ratio? Welcome back. This is nominal because there's a group or category with no ranking. They play soccer or they play softball. No ranking. One is not better than the other, despite what some people may say. Ooh, this is a tough one. Good thing you have me to help you along here. 0 to 10 pain scale. Nominal, ordinal, interval, or ratio. Pause the video, really think about it. Welcome back. I know you thought about it and you're going to be correct. It is ordinal because there is a group and category. There is a ranking. 1 pain scale is lower than a 9 pain scale, but there's no standardized scale. It is subjective. Anytime we have something subjective, people's own definition of what a 1 versus a 2 is different from other people. The last one here I've already given you as an example, so you're already a pro. We know that age groups is ordinal. There's no standardized scale in the age groups because if I have a sample of 5 people, it's not going to be that the difference between each of those 5 in age is the exact same. Here is a summary table for you. Let me tell you something. Even the most seasoned of researchers sometimes have to take a look back at this to make sure. And it's, like I said, it's very important that when you're setting up your variables, when you operationally define them, when you operationally define how you're going to measure it, using what technique, what each value or what each score means, you also want to think about what level of measurement it is, because we're going to need this information when we go on to run our statistical tests. And I will leave you with that. We are walking up the scale, walking up the stairs towards success. Have to master the basics before we can get to the others. Good job, everyone.